Working on the Frontlines is a huge honor, but I would be lying if I said, it's not nerve-wracking.
There's a lot of people right now that are, oh, this doesn't affect me, this doesn't affect anyone I know. If it doesn't, it will.
We are not here to exaggerate the situation or downplay it. We're simply telling you exactly what we're seeing.
We are seeing a lot of young people, and when I mean young 30s, 20s, that are really suffering from this disease, requiring going to the ICU and getting intubated on a ventilator for weeks on end. Some of them recover and some do not. It is not a guarantee that just because you're young, you're going to recover.
We form a team where we go around the hospitals in situations where the patients can no longer breathe on their own and requiring assistance. We go in and actually intubate these patients under very high stress environments.
Many hospitals have started COVID teams, and a pharmacist plays a significant role in that. So myself and my colleagues we're basically working on treatment algorithms right now to making sure that the therapies we're choosing are safe and effective and are based on some sort of evidence that we're looking at.
I really feel like some things have changed a lot and some things haven't changed at all. As far as the labor and delivery aspect of my job, in the vaginal deliveries, we are taking every precaution because it's a physical process and there is, a woman blowing out air and there's a potential for aerosolized particles. We are at a similar risk with the labor process. So we're being very diligent about wearing our N95s and having a full face shield on just to make sure that we're putting ourselves at as little risk as possible. I would be lying if I said, it's not nerve-wracking to go into a room with a patient who's extremely sick with coronavirus, listening to their heart and lungs, and you're literally sitting, a foot away from them. All you can think about is, as you're wearing your PPE, is little tiny things trying to get underneath, any gaps in your mask or any holes in your gown.
I'm early in my career, and I have a young child at home, and if something were to, and my wife, obviously, and if something were to happen to me, what would I do for them?
There are a lot of people that I think are not comprehending the fact that hospitals have implemented visitor restrictions or visitation. And this is with great intent to prevent the spread of the disease to coworkers or other patients that are in the hospital. But I can't even fathom the idea of being sick in a hospital and being alone.
You're being a caregiver, but you're also, providing that comfort. You try as hard as you can to be that medical professional, but also to have a human aspect of this. Because when people say that, there's people in ICUs dying alone, it's true.
We need to buy ourselves time. Time is necessary for various reasons. And most of the reasons is to collect more information, more data, so we know more about what we're going against. So in order for us to buy time, we need to take the necessary steps.
Trust me, I know quarantining is hard, but think about the difference you're making and think about how every time you decide to stay in instead of going out, you're directly helping to keep healthcare workers, their families, and everyone else in your community safe.
I guarantee you, there are people around you that are more susceptible than you know. Thinking ahead about 6 months down the line, we'll look back and say, thank God we did this. And I would rather us say we were overcautious and we were a little too strict about this than look back and say, oh my God, I wish we had been more cautious. When you do have symptoms of the disease, it can be a headache, it can be a sore throat, some abdominal pain, and you can just be one of those. And eventually the fever comes in. If you're able to go around about your normal day without feeling winded, you're okay. But when you start having that shortness of breath and you're not feeling like you can't do the things that you normally do because you are so out of it, that is absolutely a time to come. And I don't want this to discourage anyone from coming to a hospital if they think they need to. Absolutely, they should. If people at home are trying to think about when do I go to the hospital, the biggest thing I think people are doing, unfortunately, is coming in right when they feel that first symptom. Isolate at home, right? You can call your primary care doctor. We have great outpatient ways to get tested that don't require you coming to the hospital, because if you didn't have it and it was something else, you could get it just by coming to the hospital.
My hat goes off to the ICU nurses, the rapid response nurses, ER nurses, my team, the PACU, all the floor nurses. They're gowning up and going into COVID positive patient rooms and providing direct patient care sometimes for hours at a time, and doing it with compassion and courage. As cheesy as it sounds, one of my coworkers reminded us the other day that bravery isn't not being afraid, it's being afraid and doing it anyway.
I chose this profession for a reason, and there are moments of courage I do have. It really comes down to, I guess, a fight or flight response and how we approach this, and I choose to fight.
I feel like I am taking part in history. It is this moment, this critical moment that I chose to step up to make a difference, and we are making a difference.
It's very much a collective, we got this. This is what we are for society. We need to be here. We need to step up and be this person to help society through this, and let's do it.